Hello, my name is Dylan Ryan. I'm a physician assistant student. I'll be taking care of you today.
Hi, nice to meet you.
Nice to meet you. What is your name?
My name's Kayla Tracy, Tracy.
Okay. Kayla, when were you born?
4/9/96.
And what brings you here today?
So I've just been feeling really tired lately. I woke up maybe a week or two ago and I noticed that I had swollen glands, which isn't normal for me. And I've just been really lethargic. I'm not really sure if it's just because of the weather or
When did you notice these symptoms?
I'd say probably about 2 weeks ago.
And what do you do for work?
I'm a student, so I'm going to PE school.
And how has your general health been prior to this? Would you say it's been good?
Really good. Yeah, I'm usually able to exercise every day. I'm really active, and I usually have a lot of energy, but lately it's just been not the same.
Are you single, married, divorced, or widowed?
Single.
Is there any other significant past medical history that we should know about?
Not that I can think of right
Any
now.
other visits to the hospital?
I went to the doctor's 10 days ago when I first noticed that I wasn't feeling right. And my doctor gave me amoxicillin. But it didn't help, and if anything, I got a weird rash and I felt worse. So that's why I'm here.
Did you finish that dose of amoxicillin?
Mhm.
Was it a 10-day amoxicillin?
Yep.
Okay. And where were you when you first noticed these symptoms?
Probably sitting in class around 8 o'clock in the morning. I got to class and I just felt really tired. I couldn't really wake up in the morning. I just didn't have a lot of energy that day. And ever since, it's been the same.
You said you feel soreness in the throat area?
Yeah, I have a really sore throat. And when I touch my throat, it hurts. So I don't know if that's important, but
We'll look into that.
okay.
Don't you worry. So, is there anything that makes this worse?
I guess maybe talking irritates it, and coughing makes it hurt worse. It feels better when I'm just drinking hot tea and relaxing, I guess.
Were you outside in the woods playing at all prior to this?
I mean, I go on a run every day, but I'm not usually in the woods or anything. I live in Philly, so I'm usually in the city. But no, nothing in the woods or anything like that lately.
How would you say the condition of your teeth and gums are?
Good. Yeah. I just went to the dentist pretty recently and everything was fine.
Have you experienced any gum bleeding?
No.
Do you have any dentures?
No.
When was your last dental exam?
Maybe a month or two ago.
Have you experienced a sore tongue?
Mm-mm.
Dry mouth?
No.
Do you have sore throats in the past?
Not before this. No. This is just really bad.
Have you had any swollen glands?
In my throat and in my armpits.
Any goiters?
No.
Lumps?
Not other than the swelling.
Have you had any neck pain or any stiffness?
Neck pain in my throat, is that what you mean? Or
No, just kind of in the muscle area.
muscle aches, yeah, I would say. I feel like I've had a fever.
But not necessarily stiffness? And would this pain radiate anywhere?
Out of my throat? No. The pain in my throat and the pain in my muscles are really the two main things.
Is there anything that makes it worse?
Activity. If I try and run or do exercise, it gets a lot worse, and I usually feel worse afterwards as well.
Has this happened to you before?
No, never. I usually never get sick.
Would you describe the pain as sharp, shooting, dull, aching?
A dull aching, I would say, in my throat. It's not burning or anything, and when I cough, nothing comes up. It's just, it hurts. It's just painful.
How would you rate the pain on a scale of 1 to 10? 10 being the worst pain you've ever felt.
Probably a 6 or a 7.
What medications have you taken in the past, just in general?
I take birth control every day, and I take a vitamin every morning and a probiotic. I don't take any daily medications, though, other than that.
What is the name of the birth control that you take?
Orthotricycline.
And do you know of any allergies that you have to any medications, foods, environment?
I'm allergic to penicillin. Whenever I take it, I get a really bad rash. And I just have like normal seasonal allergies, but I usually take Claritin for it and it goes away.
When you got that rash with penicillin, where did it occur and how long ago did that happen?
Probably when I was 11 or 12 and I got hives all over my arms and legs.
Any other allergies?
Not that I can think of, no.
Do you have a latex allergy?
Mm-mm.
Iodine?
No.
Chlorhexidine?
Mm-mm.
Is there any childhood illnesses that we should know about? Chicken pox, measles, mumps.
I had chicken pox when I was 9. It only lasted a little while and nothing bad happened after that. And I had my appendix out also.
When did that happen?
When I was 13.
Did it all of a sudden just have a really bad pain in your stomach?
Mm-hmm. I woke up in the morning with a sharp pain in my side. I got it taken out that day and everything was fine after that.
Okay. Have you ever had any rheumatic fever?
No.
Scarlet fever?
Mm-mm.
Polio?
No.
Any psychiatric disorders?
Mm-mm.
All right. And in reference to your childhood immunizations, did you get the polio vaccine and the measles, mumps, rubella?
Yeah, as far as I can remember. I know I had to get a bunch for college as well.
Okay. So have you had the flu vaccine?
Yeah.
Tetanus?
Mm-hmm.
Diphtheria?
Mm-hmm.
Pertussis?
Yes.
Hepatitis B?
Mm-hmm.
And pneumococcal?
Yeah. I think before college, right?
Yep. Usually we do that in our office, yes.
Okay, perfect.
And after childhood illnesses, have you had any adult illnesses?
No, not that I can think of. I think that's why this is so weird for me, because I'm usually really healthy, so.
Do you have any history of hypertension?
No. My dad does, though. I don't know if that's important.
When was the last time somebody took your blood pressure?
Maybe my last annual checkup, so a year ago.
Okay.
It's been
We'll do that today, too.
Okay.
Have you ever had diabetes?
No.
Tuberculosis?
Mm-mm.
Heart disease?
No.
Lung disease? Kidney disease? Thyroid disease?
Mm-mm.
HIV?
No.
Seizure?
No.
Cancer? Asthma or hepatitis?
Mm.
Right. Have you ever been hospitalized for any injuries or been involved in any accidents?
I broke my wrist once when I was 15.
Which wrist?
My right wrist.
How did you break it?
I was cheerleading and I fell from the top and landed on it wrong. I was in like a little cast for a few weeks.
What are those called at the top?
Flyers.
Flyers?
Yeah, that was me.
Flyers, okay.
Wasn't always the best position though. And other than that,
Did you have a... Sorry, go ahead.
No, go ahead.
Did you have a cast for that?
Yeah.
Okay.
Mm-hmm.
All right. You don't have any problems with that now?
Mm-mm.
you about to say before?
I think I was going to say another injury. Oh, I had a concussion, too, from that incident. I don't know if that's important, but I was out for a few months, and everything went well after that, though. It was good to take a break. So.
For treatment for that, did you just kind of lay low?
Mm-hmm. Okay. Yeah, no activity, and I wasn't recommended to watch TV for a long time and stuff like that. But.
And you don't have any problems with that now?
Mm-hmm.
Have you had any surgeries in the past? Wisdom teeth, anything like that?
Mm-mm. No, I had stitches when I was younger. I just cut my foot on a knife, or my hand on a knife, and I had 3 stitches in my left pointer finger, but no surgeries or anything serious other than the appendectomy.
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 Okay. Have you ever had the zoster vaccine?
Yes.
And when was your last mammography?
I haven't gotten one yet.
Would you like for us to do that today?
If it's recommended, I'd be willing to, sure.
We can do it?
Okay.
Oh.
Sure.
When was your last pap smear?
I just turned 21 in April, so I haven't had one yet. Is that something I should probably start doing?
It's good to get in the routine of doing that, sure.
Okay.
Couldn't hurt.
Okay.
And have you ever had a colonoscopy done before?
No.
Any DEXA scans?
No.
Or TB tests?
I've had a TB test before going to PA school, but everything was negative, so.
And when was that?
In July of 2017.
Have you ever had a cholesterol test?
Mm-mm.
A cold blood stool test?
Mm-mm.
Alright, so now I'm going to talk about your women's health, and just let me know if anything makes you uncomfortable, and I'll refrain from asking those questions. Okay?
Okay, thank you.
At what age did you get your first period?
14.
How often and long is your typical menstrual cycle?
5 days, maybe.
And how heavy is your typical flow? Light, medium, heavy?
Pretty light. That's nothing terrible.
And when was your last menstrual cycle?
2 weeks ago.
Have you ever experienced any amenorrhea or absence of your period?
No. The birth control keeps it pretty regular.
Have you ever had any painful periods? Really painful?
Nothing out of the usual, no.
Do you have a history of any STIs?
Not that I know of.
Have you ever been pregnant before?
No.
Alright, now I'm going to ask you a little bit about your family history. If you could tell me about your parents and grandfather, grandmothers, anything like that. Okay, so let's start with your paternal grandfather.
Okay. He's 82 and healthy. He has high blood pressure as far as I know. But other than that, he's fine.
Okay. Tell me about your paternal grandmother.
She's also healthy. She's 80 as well. She has hypothyroidism. She takes medication for that. But other than that, she's healthy as well.
Okay. And your maternal grandfather?
Both my maternal grandparents are deceased.
Okay. And your father?
He has hypertension. He's 56. He's healthy, though. He exercises every day.
You guys ever work out together?
Sometimes, yeah.
You go out for runs?
Yeah.
That's cool.
He's a good motivator.
Right. My dad's not a big running guy, but maybe someday.
Yeah.
Alright, and your mother?
My mom is 55.
Okay.
She's healthy. Also exercises every day. So, we're a fit fam. Trying to be, anyway.
Any siblings?
An older sister.
She part of the workout crew as well?
Yes.
Very nice.
Of course. She's 36. She has anemia. I don't know what kind, but other than that, she's healthy as well.
just it's gonna ask like I'm gonna ask you a million questions, but gotta ask them.
Okay.
Have you ever had any history of headaches?
No, other than my concussion. No.
Okay. Seizure disorders?
No.
Stroke?
Mm-mm.
Mental illness?
No.
Suicide?
Mm-mm.
Any substance abuse?
No.
Have you ever smoked weed or anything like that?
No.
Okay. Thyroid disease?
Mm-mm.
Coronary artery disease?
No.
Any asthma or lung disease?
No.
Any renal disease that you know about?
Mm-mm.
Or arthritis?
No.
And you said you have seasonal allergies, right?
Every springtime I get them pretty bad.
Do you have any genetically transmitted diseases?
Not that I'm aware of, no.
And I'm going to ask you something about your social history. So, where were you born?
I was born in Schuylkill County, PA.
You're going to have to help me spell that one.
Schuyullkill.
Interesting.
It's about an hour outside Philly. That's usually what I say.
And what was your childhood like?
I had a great childhood. Yeah, school was good. My family was really good. Good friends.
And what is your highest level of education?
I'm currently in graduate school to get my master's.
And have you ever had any previous occupations prior to being a student in grad school?
I waitressed and just like little side jobs, but nothing major.
And what is your living environment like?
I live with 4 other classmates from school. It's really good though. It's good to live with other students. I think it's helpful to get through it.
And about how many steps would you say are in that house?
There's 2 sets of stairs, maybe with 15 steps each, so 30 steps altogether, I would say.
And you're not related to any of the people in the house?
No, just friends.
And do you feel safe at that house?
Mm-hmm.
Do you have any pets?
No.
I know I had a dog when I was going through school, and that definitely helped me a lot. I had
We
a nice
really
puppy
want
lab.
to. We really want to.
Yeah.
I just feel like it's hard with the time to
Yeah.
take care of it.
One of my roommates was graduated, so he mostly did the taking care of the dog.
Oh, I
Yeah,
wish.
it worked out.
It's like my dream.
Do you have any recent or long-term stressors in your life?
PA school is pretty stressful, if that counts for anything.
Yes, it is.
But other than that, no. My family's been really great, supporting me through it, so it's good.
Were you ever in the military?
Mm-mm.
And what would you say your financial situation is?
Stable. Yeah. I'm not working, but being a student's a full-time job.
Right.
Other than that, it's good.
What do you do in your free time when you're not studying?
Before feeling like this, I tried to exercise or go home and see my family whenever I can as well.
All right. And do you have any religious affiliations?
I'm Catholic.
Have you ever been to church around here, around this area?
Yeah, I've gone to St. Bridget's on Midvale
Yep.
Ave.
That's where I go.
Oh, really?
Yes. Mhm.
It's a small world.
And what are your normal sleeping habits? I know you're probably not getting the most sleep. But
Yeah. I usually try to go to bed around midnight and average maybe 6 hours of sleep a night. It hasn't been too terrible yet.
Right. And to go over some activities of daily living. So, do you bathe yourself?
Yes.
Do you dress yourself?
Mm-hmm.
Go to the bathroom yourself?
Mhm.
You make your own breakfast?
I do. Scrambled eggs every morning.
And your own grocery shopping?
Yes.
And laundry, bills, and housekeeping?
Mhm.
What would you say your typical diet is? Give me your breakfast, lunch, dinner.
My breakfast, like I said, is usually scrambled eggs with fruit. Lunch, I like to have a salad with maybe a yogurt. And dinner is usually rice and chicken or some type of like a carb or grain.
How many ounces of fluid would you say you drink a day?
A lot.
A lot?
Yeah, a lot of coffee, a lot of
A lot
water.
of coffee. How many cups of coffee do you think?
Maybe 2 or 3. And a lot of water because that helps me stay awake when I'm trying to study a lot.
Right. How many maybe bottles of water would you say per day?
3 or 4.
And in regards to alcohol consumption, how much do you drink?
I drink on the weekends whenever I can. So at max, maybe a night or 2 a week.
And during that 1 or 2 nights, how much do you drink, would you say?
Maybe 3 or 4 drinks. In just like a normal little glass.
Okay.
Were you gonna ask?
Normal glass, as in like just a little water cup or
like a pint glass.
pint glass.
Yeah.
And in what type of settings do you drink alcohol? Is
Usually
it social? Is it with friends?
Yeah.
Is it, okay.
Yeah, definitely.
Watching a movie?
Yeah, some wine after a long week for sure.
Right. And have you ever smoked tobacco?
No.
Okay. You said you exercise about how many days a week would you say you do that?
5 or 6 days. My roommate and I actually just signed up for a half marathon, so we're like forced
That's awesome.
to try and do it. Yeah, thank you.
Is that here in Philly?
Mhm.
Okay. Is your dad or anybody else doing it with you?
They'll be there to support us. I don't know if they're going
That's
to be
great.
running it, but maybe next time.
Do you wear a seatbelt?
Yes.
Do you wear a helmet when bicycling?
I usually don't bike, but when I do, I wear a helmet.
Do you wear sunblock?
Sometimes.
Sometimes. Definitely want to have you wearing as much sunblock as you can. Do you lock your medicine cabinet?
I don't really have any medicine in it. I just have like Advil and stuff, but
Do you lock any chemicals at all in then maybe the kitchen or anywhere?
yeah, cleaning chemicals,
Yeah.
definitely.
Alright, so back into the sexual history. And again, if any of these questions are uncomfortable, just let me know.
Okay.
Alright. How many sexual partners have you had in the last year?
The last year, 2.
And what types of contraception do you use besides, as you said, the pill that you were taking?
Usually use condoms.
Do you use any laxative? Do you use any street illicit drugs? So because violence is so common in so many people's lives and because there is help available, I ask every patient about domestic violence. Within the past year, have you ever been hit or slapped or kicked or otherwise hurt in any way?
No, definitely not.
Do you feel safe when you're with one of a partner?
Yes.
Thank you for telling me that. And so back to your condition, you said that, give me 1 second here. Okay. Just make sure it's right. Back to your condition, you said that you had a rash, right?
Mm-hmm.
And you said you weren't really in the woods though,
Mm-mm.
but you go for runs?
Yes.
And is that just on a paved pathway
Yeah, usually
Okay.
through the towns. And,
through the towns?
yeah.
There's no really grass or anything like that?
Mm-mm.
Okay. And have you ever taken amoxicillin before?
No.
No. Okay. All right. Well, our time is up, unfortunately.